Now I will be demonstrating how to do basic vital signs, which include temperature, height and weight, pulse, and respiration. First, we're going to start off with temperature. Although there are many different ways to take your temperature, I'm going to be using the tympanic thermometer, which will be going in this patient's ear. Before taking a patient's temperature, you're going to apply a probe cover to the end of it. Make sure your patient's hair is out of the way. You're going to pull the ear up and back, inserting the probe in the ear. You're going to press the button, wait for the beep, and the patient's temperature will be on the screen. The next thing we are going to do is the pulse, which you will take at the radial artery. You will place 2 fingers on the thumb side of the wrist, palpating around until you find the heartbeat. You'll watch the clock for 30 seconds, counting the beats that you can feel. After you hold the pulse for 30 seconds, you will remember that number and multiply it by 2, giving you your beats per minute. After you've held the wrist for 30 seconds, you will continue holding the wrist, acting like you were taking their pulse, but you will actually be taking their respirations. For another 30 seconds, you will watch the chest rise and fall. Remembering that number, you will multiply it by 2, getting your respirations per minute. Next, we will be doing height and weight, and we're going to start with the patient's height. While your patient is taking off their shoes, you will place a paper towel down on the scale. When helping the patient onto the scale, you will have them face outwards and step back onto the scale, making sure their heels are all the way back. If your patient is on the scale, you will lift out the level, making sure not to hit your patient in the head. You will lower the height bar until it is firm on your patient's head and level so that your patient can have an accurate height reading. You will help your patient step off the scale and take your height reading. After you have taken your patient's height, you will take their weight. You will again help your patient onto the scale, making sure their feet are in the middle. To take a patient's weight, you will move the bottom weight to the patient's estimated pounds.
Yes.
Then you will move the top weight to the appropriate pound, making sure that the bar is level in the middle. You will then add the 2 numbers, giving you the patient's total weight, and you may help your patient off the scale. And that is how you take basic vital signs.